Welcome to Knowledgeable Aging. I'm your host, Jason Kotar. Joining us today to talk about how to assess how your aging parent is doing is Vivian Green Corner. Vivian's clinical experience is extensive, including hospital, residential, and community-based settings. She is a certified dementia care practitioner and trains home health professionals to render effective dementia care in the home, rehabilitation centers, and residential facilities, and offer guidance and support to family caregivers to enable a higher quality of life for adults with dementia. As an advocate for the dementia community, she creates and coordinates town-based Alzheimer's awareness symposiums to raise awareness and offer caregivers needed information, guidance, and community resources. How are you doing today, Vivian?
I'm doing good, thanks.
Thank you for being here. Looking forward to our conversation, but before we get started, for those that are joining us, if you have any questions, time permitting, we will do everything we can to get those questions answered, so go ahead and type those questions into the box. So Vivian, I'd like to get started. What are the areas of change in an aging parent to pay attention to?
You know, there are 7 areas of change that I'd like the audience to consider. The first one is there a change in weight? Is your parent or elderly, are they losing weight or have they gained weight? Is there a change in their weight? Is there a change in their emotional state? Do they seem more sad or anxious? Is there a change in their cognitive functioning? I'll discuss this in more detail. Is there a change in their energy level? Do they seem more tired? A change in their mobility and gait? Are they walking slower? When they walk, are they holding on to things? Are they holding on to a chair? Are they tripping more? Is there a change in their hygiene? If your parent was always very fastidious about how they dressed and what their hair looked like, and if they wore cologne or perfume, is there a change? Is there a change in their hygiene? How about their clothing? Do you see, are they soiled? Are they not changing their clothing as often? Really look for the changes. And is there a change in their home environment? And I can talk about that in more detail also. Now, for some of you who are available, who do visit your parent, you can check out any areas of change. But I know not all of you do live close by. So I would suggest that if possible, you get another relative or a friend to come in and look for those areas of change that I mentioned. In the interim, though, if you are long distance, you can start to explore some of these areas by phone. You won't be able to see your parent. Maybe you can FaceTime them or Zoom, but you really want to have a conversation, not one with how you're doing, because you're going to get a yes or no answer. I'm fine. Not as good, but really more open-ended questions. It's not an inquisition, it's a conversation. But for instance, you can, regarding weight, you can say to them, how are things doing? Have you been able to cook as much, or with COVID, go out to the supermarket? How has that been for you? Because I know it's been a change for me, and have a conversation about that. You can say things like, what have you been up to? Have you gotten a flu shot? All of this is conversation and will give you information. Are you starting to prepare for changes in the season? You usually change your closets. Have you been doing that? You need to listen, because you will be hearing things. In that conversation, they might say, well, you know, I'm too tired. I don't really need to change my clothes. Or, yeah, there's some household chores, but you know what, I'm just feeling too overwhelmed by it. Or in fact, they might be calling you more often with more questions. So those are the changes that you want to consider.
Vivian, you had mentioned cognitive functioning. So when I think about cognitive functioning, what are the indicators of change when it comes to that area?
Good question, Jason. So there are some specific areas that you want to look at. You want to see if there's a decline in retaining new information. Something that's happened recently that they can't remember. If they had a doctor's appointment, you can ask them, did they go? What did the doctor say? Or other appointments that they might have, or somebody coming into the house maybe to assist them. How did that go? You really want to get a sense of what they're doing currently, and if they're able to tell you what is going on with that. Another sign might be that they're asking you questions and repeating the questions. You've given the answer, and a few minutes later, they'll ask you the same question again. That means that they're really not retaining information. If there is a kind of more active search for familiar things, they can't find their wallet, they're looking for their keys or their hearing aid, and there's kind of a constant search and rescue going on. That's another area. If your parent or your elderly was always great at planning and organizing, and they're just not able to do that, they're not able to follow through, that's another area of change to consider. At events, social events, I know we've been not having as many with COVID, but if there's any event or interaction and they're becoming more withdrawn, you want to pay attention to that. It could be an issue that they're not hearing properly, so their hearing needs to be checked. But if there's no hearing issue, that might be another indication that they are not following the conversation, or they don't know what to say at an appropriate time. And if, again, this is common, if you start to get frequent calls asking you for items they've missed or reminders of appointments, if they're kind of asking you to be their memory, and that happens frequently, those are all signs of change. Often people will notice that with their parent and dismiss this as, well, you know, they're older, people do become more forgetful, and that is true. It is a part of normal aging to be forgetful, but when it impacts on their functioning, that's when you really need to be paying attention.
You talked about environment earlier, Vivian. What type of changes in your parents' living environment are indicators of change?
So, another good question, Jason. If your parent or relative has always been very neat and organized and independent, and they are no longer so neat and so organized in their home, that's one indicator. If there's clutter in their living space and that's unusual for them, another indicator. Are items laying around or items misplaced? Is there spoiled food in the refrigerator? Often people don't look in the refrigerator, and that's important to look to see if there is spoiled food in there. Are there dirty dishes in the sink? Burnt pots and pans? You sort of have to be a little bit of a Sherlock Holmes with this. Are there foul odors in the house? Are there significant items out of order or in need of repair? And as I mentioned about opening the refrigerator, you need to also check prescription bottles. Literally count the number of pills and the corresponding dates to refill. Is everything as they should be with prescriptions? Are there empty bottles there with no pills in it? Look around, open up cabinets, the medicine cabinet, and also really look for expired dates on any medications, both prescription and over the counter. And the last thing is, are there any unpaid bills that are hanging around? That can be a real indicator of change. And the last I want to mention is, if your parent or relative is driving Check the vehicle both inside and outside. Are there any changes in the condition of the vehicle? And I strongly suggest that you go for a ride as a passenger to assess their driving skills as to see if they are safe and competent drivers. Especially as we all age, our vision changes, our hearing changes, and regarding dementia, our spatial awareness can change. And it's not that people don't have the ability to drive, it's that they don't drive well anymore. And that's something to check. So if they're driving, check the car.
So Vivian, all good information. So if you're a son or a daughter and you notice these changes, what action steps can you take for a parent?
So once information has been gathered, the next step is communicating your concerns to your parent or relative. And start by sharing what you have noticed and that you want your parent or relative to remain safe and healthy, active now, and going to the future. When you tell them things you've noticed, be specific and concrete about the changes that you've noticed, and please don't say them in a judgmental way. You're just relaying information. You don't want to say it in a judgmental way. Otherwise, their back's going to be up against the wall, and it's you're not going to be able to really engage them. It's hard for older adults to accept change. They are already dealing with changes. Many of them are retired. It's a big change. Many of them have friends that they've lost or who have moved away. Many of them have had changes in their physical health. So change is not something that they welcome. And often they don't want you in their business. They really want their independence. They don't want to feel as if you're going to come in and create change and then they're going to be dependent upon you. So it isn't an easy conversation, but it is important to engage your your parent to accept changes. So it's important when you're talking to them to be available for their input and together to discuss ways to improve the situation. So you need to pick a time and a place for this conversation. Is it best to talk during the day? Can you go there to their home and talk, or is it by phone? Do you want to be talking around the kitchen table? It sounds small, but it's really important to engage them, that they are most comfortable and most available for the conversation. So for instance, you might want to do it not at 9 o'clock at night when they're tired, or you might want it during the weekend when you're more available. It's important, but unless there's a crisis, it's not urgent. So it's very important, and I can't underscore this more, that you do pick the best time and place to have the conversation, and also who to have the conversation with. Maybe you want to bring in another family member, not to gang up on them, but the person that they will listen to when you share your concerns. Again, you want to convey your concerns in a non-threatening manner, in a non-critical manner, to achieve the most successful outcome. And be prepared that this conversation might need to be continued. You might need to plant the seed. And if you're finding that they're really not engaged, stop it and say, you know what, I think we've talked enough. Would you be willing to talk another time? and then discuss when that other time will be. I can tell you from my clients, it's rare that it's a one-shot deal, and you might have to revisit it a number of times to create that kind of change. But the engagement of your family member is critical, and you want to do it in a step-by-step fashion. What you don't want to do is notice that there's a change and say, you know, I've noticed that there's some repairs and I'm having Joe come in next Tuesday. I know you're available, so be home at 11. It really doesn't support their dignity, and you're not going to have a successful outcome if you approach it that way. It really has to be focused, but more engaging. Once you have noticed some changes, you want to create a plan. But I want to underscore that that plan should not be not just what your parent needs now, but if you've noticed changes will continue. So you need to create a plan thinking not just for the present, but for the future. So if you're concerned, for instance, about some issues that I raised, about a change in weight or energy level or mobility or cognitive functioning, you want to first start with your plan. You want to first start with your parent's primary physician. You want to have them go have a good, thorough medical checkup. That's going to look into their weight, their gait, their emotional state. Are they having signs of sadness, or is it moving into depression, especially now with COVID and isolation? Loneliness is a feeling, but if it moves into depression, that needs to be treated medically. So you really do want first to have a good medical checkup. If it does involve cognition, chances are that your primary therapist would suggest to go on for a neurological workup. If you are available, it would be best to accompany your family member to the doctor's visit. Often that can be overwhelming, and you just want to make sure you're getting all the information, any recommendations that were made. And if that is not possible, to be present, again, see if you can find another person to accompany. And if that is not present, possible, you want to contact that doctor's office and ask if your parent could sign the consent, that's HIPAA, sign the consent that allows you then to get that information. And that is critical. You really want to connect with your parents' physicians so that they can give you information. You also want to be able to contact the physician ahead of time and say, these are some of the changes that I've noticed. And I'd like you to assess in my parent. As far as making home improvements, so that you're allowing your parent to move more easily in the house and in and out of the house, you want to look at things. Do they have adequate lighting? Do you need to move some scattered rugs? Is there too much furniture? Do you want to change that chair to maybe a lazy boy chair, which is easier for them to get in and out of? Do they need grab bars? Their laundry. Is the washing machine and dryer still in the basement? Is it a second set of stairs they're having going to? Maybe you want to look at moving a washing machine and dryer to another floor, which they have easy access. Just generally, do they have easy access to things? Their pots and pans, the bowls that they use, you don't want them reaching high for that mixing bowl. If they bake, you really wanted things out on the counter for them and easy access. So you kind of have to put yourself in your parents' shoes as to, what would make it easier for them to move around. In everybody's area, you do have a senior or aging department. Every county does. So you can call the county. Many counties, I know in my county, they have people who are licensed who will come out free of charge and do home modifications. You just need to supply the equipment, the grab bars or the rails. So everybody should check out their resource in their parents' community, in their county, for their Division of Senior Services, or it's called the Department of Aging. If your parent is part of your care plan, as I mentioned, there's stale food, or you're finding that they might be loss of weight because they just don't have the energy for the food prep anymore, or they're not taking their medications properly, or they're not getting to the laundry and it's not reasonable. You might want to consider bringing in a companion, either from a licensed home health agency or somebody privately. And lastly, it is the time, if you see indicators, if you haven't done so, part of creating your action plan has to include a financial plan, because you need to know, and this is not an easy conversation, but you really need to know what your parents' finances are. And do they have the funds for what we just mentioned in terms of home modifications or bringing in an aide? Do you need to prepare to put money aside in your own savings to take care of your parent? Are they going to continue, as I mentioned, not just presently, but in the future, to reside at home? And if you want to look at options, are you going to be looking at communities that have assisted living or independent living or memory care living? And how much do these facilities charge? So as far as your action plan, you need to include that financial planning piece. And start to know where your parents' documents are. Who is their attorney? Who is involved in their finances? These are important documents that you should have access to.
One of the issues I think we have in society is we're not very proactive, we're reactive. So putting together this action plan, it needs to happen before you start to see your parent having these cognitive issues, right?
Yes, it's interesting. I have a financial planner, and in creating a plan in terms of my kids' college education, they asked me, do you see that you will need to financially support your parent? And that was early on. My mom's 99 now, and people live a long time. So yes, it is very important, Jason, to really be proactive in thinking not just about now, but planning for the future. And in my work, many of my caregivers say, well, I'm retired now, so I'm thinking about moving mom to come live with me. And I stop and I say, we need to talk. We need to talk about what that will be like for your mom and what that's going to be like for you or your husband. Because it can start now just being a room, but it might end up being that you're going to need to require to give your mom care. So how will that be in your retirement? And then I have a whole list of questions to ask, so that people are not just thinking about their parent, but thinking about the impact it's going to be on them and if it's sustainable.
Yeah.
I have families that have said, as an example, I vowed never to put my husband in a nursing home. And I say to them, I understand that, but how old were you when you made that vow? Did you say it in your 20s and your 30s?
Mm-hmm.
How is your husband's health now? And we can't just be stuck on the vow. We have to look at what his needs are and how those needs are best met. So yes, we need to be very proactive. There are things that come up in crisis, a fall that we didn't expect, but not everything is a crisis. And there are lots of solutions out there now. There are a lot of assisted technology devices out there that we never had before, in part thanks to COVID. There's lots of home monitoring devices that are out there. And there are a lot of assistance. People are on board to help you.
How do you help families? You mentioned this is what you do professionally. So is it safe to say that working directly with the personal caregiver, which is the son or the daughter, is the first step?
Yes, absolutely. It is the first step. Yes, yes, yes. It is the first step. And I am often brought in because families need problem solving. They need help to create an action plan with solutions and contacts to services and professionals and local agencies to implement the needed changes. They might not be in the area, but that's the work that somebody else like myself can do to connect them with services and professionals and local agencies. In my work, as two examples, I have a client who has a summer home in the Berkshires and has an aide in their home in New York City, but wanted to be able to go up to the Berkshires during the summer and needed an aide, and I was able to find some choices, and they were able to get aides up in the Berkshires. I have a family that contacted me that came up from COVID from Puerto Rico and were going home, and we needed to set up a care plan for them in Puerto Rico, which I did. Again, contacting services, contacting local agencies. So that's the work that professionals like myself can do.
Very good. Last question, Vivian. How frequently should this evaluation of a parent take place by you or a personal caregiver?
That's a very good question. I think a good start, a very good comprehensive assessment, and then everybody has to be tweaking it along the way. You might, as I mentioned, I gave you 7 indicators. You might see one now, but keep a list of those other indicators that I mentioned to you, both the 7, then the cognitive, and then what's going on at home. People get older, but they become more frail. So it's an ongoing process. I can't say do it every 6 months or every year. It really depends on your personal situation, but you do now have a good list to work with.
Very good. Well, thank you, Vivian. So how can people find you?
Well, I have a website, which is Vivian, VivianGreenKorner.com, VivianGreenKorner.com. My email is the same. It's VivianKorner@gmail.com. And lastly, just give me a phone call, 201-960-4277.
Excellent. So at Knowledgeable Aging, this webinar will be up on our YouTube page. I encourage you to go to YouTube, type in Knowledgeable Aging, and subscribe. We do about 3 live webinars every week. This will also be converted to our podcast. You can find us on Apple Podcasts, Spotify. Till next time, I'm your host, Jason Kotar, and this is Knowledgeable Aging.